Welcome to this Ask the Expert session, where I will be answering some questions regarding the management for chronic rhinosinusitis with nasal polyp. I'm Joseph Hahn, professor of otolaryngology, chief for the Division of Rhinology and Endoscopic Sinus and Scoping Surgery at Eastern Virginia Medical School in Norfolk, Virginia. I'm also the vice chair of clinical affairs and administration. The most common symptom for chronic sinusitis in general is nasal congestion. If you have nasal polyp, they will also have concomitant decreased sense of smell. So their sense of smell will be diminished, or they will have no sense of smell. A lot of the times, the patients will say that they lost their sense of taste, but what it is really smell or flavor. And so if someone has nasal congestion and loses their sense of smell, that would be a good detection or a good symptom to tell us that they probably have nasal polyps. So for recurrent acute sinusitis, if you have 4 in the ear, they will say it's chronic sinusitis. So how do you separate chronic sinusitis with acute exacerbation or recurrent acute sinusitis? Well, it's easy. If you have recurrent acute sinusitis, they have these symptoms with medical treatment or even with time, the symptoms will completely resolve. They will be completely gone. Now, if you have chronic sinusitis with acute exacerbation, they will have underlying baseline symptoms. They will be able to tolerate those symptoms, but the symptoms will never disappear. And with an acute exacerbation, whether it be a viral infection or allergy exposure, they will have worsening of their symptoms. Well, the answer depends. It depends on how long the polyp has been there. If it's relatively new and it's mostly edematous water, and there's not a lot of fibrosis, with the biologic, it can disappear. And in fact, according to the phase 3 studies, we've seen that some of the polyps that are 2 to 4 have disappeared completely. But if the polyp has been there for a while and it's fibrotic, the biologic will thin out the nasal polyp, but will not make the polyp disappear. So for those patients, the only way to really make those fibrotic polyps disappear that are really thin is to do surgery. Well, I think this is a trick question because even with the addition of a biologic, majority of the patients still need some type of topical steroids. Now, the whole reason for the biologic in patients with nasal polyp is try to get them off any type of systemic steroids, like oral steroids. But topical steroids, such as nasal steroid or, ADUs, fluticasone, those are treatments that I think is the basic underlying treatment for a patient with nasal polyp. And biologic is really meant to be an add-on treatment. Now, we have seen that with patients with nasal polyps, when we give them a biologic, about 20 to 25% of the patients have been able to use the biologic and get off the topical steroids. But I would say the majority of patients still need some type of topical steroid. This is a very important question. And the reason is because a lot of the patients who need biologic, whether it be for asthma or for the nasal polyp, usually have either asthma or nasal polyp. So a lot of the patients who have asthma and nasal polyp are the ones that usually need biologic. And so sometimes the biologic can work better for the asthma. Sometimes the biologic can work a little bit better for the nasal polyp. We see this, and this is not uncommon. And I think, when you're trying to decide, should you switch to biologic or should you even talk about surgery, has to be a multidisciplinary approach. So, for similar patients like this, I usually talk to the allergist, the pulmonologist, and they also call me as well to talk about, how do we change it or what do we change it to? In general, I will say if you start a patient on a biologic, whether it be for their asthma or nasal polyp, most people will say wait 4 months for their asthma, 6 months for their nasal polyp. And if it's not getting better, that's where you have this discussion. Thank you for listening, and I hope this cleared up some of your questions.